I'm going to be talking about the medical model. The medical model can be described and defined as a traditional approach used to diagnose and treat people who are sick. The diagnosis and treatment is traditionally performed by doctors within the Western world. This model is culturally accepted as being based on scientific principles. These scientific principles support the biological approach, which is the idea that all disorders have an organic or a physical cause. The biological approach also states that mental disorders are connected to the functioning and the physical structure of the brain. This medical model has a problem-solving focus instead of, say, a preventative focus to address the mental illness a person is experiencing. While doctors are the main professionals within this medical model, they will often work alongside other professionals, such as psychiatrists, to help those with mental illness. The medical model is mostly used within the hospital system. It was designed to meet the conventional needs of practice and procedures for health professionals. The medical model procedures begin by medical history being taken from the patient. Then a physical examination and diagnostic testing is used to help doctors identify the illness and to prescribe the treatment that the hospital will be using for that patient. Traditionally, the patient isn't given other treatment options. The symptoms of mental illness in this medical model are generally viewed in the same way any other physical illness, such as diabetes or a broken leg. This was originally thought to reduce stigma for those experiencing mental illness, but it fails to take into account the social impact friends and family structures have on a person who is experiencing mental illness. The symptoms a patient experiences are recorded by the doctor, and then they're grouped to form a diagnosis. There is a current list of official mental illnesses, which are called the DSM, the Diagnostic and Statistical Manual of Mental Disorders, or it's also known as ICD, which is the International Classification of Diseases. This list is constantly altered over the years. A diagnosis is known to be useful in that it means a referral can be made to a specific health professional within the hospital system. When a patient is hospitalised for binge eating disorder, it is often, not always, followed with other mental illnesses such as depression, anxiety and suicidal tendencies. The medical model practice, depending on the severity, is to prefer to treat patients with a diagnosis of binge eating disorder in an outpatient or a social setting. It is the outpatient setting that the social and nuclear structures of family and friends can be considered. Thank you.